Where is the pelvic floor and what does it do? The pelvic floor is a broad group of muscles that support the pelvic organs, such as your bladder and bowels, and aid in urinary and fecal continence. The pelvic floor muscle has openings for the urethra, vagina, and anus. The pelvic floor muscles normally wrap firmly around these openings to help keep the passages shut. There is also an extracircular muscle around the anus called the anal sphincter and around the urethra called the urethral sphincter. Damage to the pelvic floor can create urinary or fecal incontinence, painful intercourse, and pelvic organ prolapse. Age, menopause, pregnancy, and a history of pelvic surgery or hysterectomy can lead to damage. The pelvic floor can be consciously controlled and trained through physical therapy. These muscles provide support to the organs that lie on it. The sphincters give us conscious control over the bladder and bowel so that we can control the release of urine, feces, and flatus or gas, and allows us to delay emptying until it is convenient. When the pelvic floor muscles are contracted, the internal organs are lifted and the sphincters tighten the openings of the vagina, anus, and urethra. Relaxing the pelvic floor allows for the passage of urine and feces. Pelvic floor muscles are also important for sexual function. Voluntary contractions or squeezing of the pelvic floor contribute to sexual sensation and arousal. Why do you need pelvic floor physical therapy? There are multiple pelvic floor conditions that may need physical therapy. One is muscle laxity of either the front or the back of the vagina, stress incontinence, urge incontinence, and any combination of those. Painful intercourse can also be helped by physical therapy. Physical therapy exercises can help provide a better quality of life by learning to control these symptoms. Pelvic floor physical therapy. Your doctor can send you to a physical therapist, or you can work at home to try to rebuild muscle strength. The therapy session is an hour a week and normally lasts for 6 weeks. You may feel uncomfortable exercising the vaginal muscles at first. However, most people see great results after therapy, and it can help defer further surgery. Post-therapy and results. After 6 weeks, if you do not see improvement in bowel and bladder control, your doctor may prescribe medication or even suggest further surgery. If you experience stress incontinence, your doctor may suggest another procedure for leakage. For laxity of the vagina, there are surgical options as well. Sometimes surgery must be done to improve both sexual function and leakage. Not every surgical problem requires surgery. Often other techniques can improve function. Talk with your doctor. Pelvic floor physical therapy may be right for you. Thank you for taking the time to view our video. We hope that you are better informed about your upcoming procedure. Your nurse or physician will be with you shortly to answer any further questions that you might have.